Public for months about what an overwhelmed healthcare system could look like. Now they are seeing the consequences firsthand. Rising COVID numbers pushing hospitals to capacity and forcing crucial surgeries to be postponed.
Instead of booking them for surgery maybe in 2 weeks, it might be pushed to 4 weeks. It's been disappointing for sure.
We spoke on the phone with Dr. Ahmed Chadi, a surgeon with the University Health Network, who says it has been difficult breaking the news to patients with very treatable and curable cancers, because the longer his cancer patients have to wait for a surgery, the less optimal the outcome. And the backlog is trickling down to other areas.
My non-cancer patients, even just to be assessed, are waiting for months and months. Their quality of life is being affected.
Giving priority to COVID patients over patients with other needs has been a dilemma medical professionals have been debating since the start of the pandemic.
It may be a long time before we really know whether we had the equation right. Whether we made the right decisions with surgical cancellations when we made them, giving priority to protecting intensive care unit beds. Obviously, there's harm. There's no question about that. But when the harm hits and how much harm there is, it's going to take a long time to really figure that out.
Currently, 998 patients are hospitalized with COVID-19 across Ontario. 329 are in ICU and 228 on ventilators.
It's awful. The numbers are very, very disturbing. Obviously, what we're doing so far isn't working.
Ontario is 1 week into a province-wide lockdown. The Ford government was first criticized for delaying until Boxing Day, and then for its slower than expected rollout of the COVID-19 vaccine. The province has administered a total 37,551 doses. That means just 0.25% of the population has been vaccinated so far.
It is very, very slow. There's no question. We obviously don't have this situation under control at all. The numbers are terrible. Vaccine is our main hope. And when we look around the world and we see other countries like Israel and things really, really pulling out in front, it's going to be tough. I hope this gap closes soon.
In the meantime, the message from doctors remains the same: stay home.
That one single visit to your friend or family member, you don't know about the downstream effects that might ultimately have on patients.
Health officials started administering the first doses of the Moderna COVID-19 vaccine to long-term care residents in Ontario this week. They received 50,000 doses of the Moderna vaccine this week and 90,000 doses of the Pfizer vaccine in December. Now, the hospitals are not the only public sector being affected. Our Maliha Sheikh has been speaking with a parent who is facing a less than ideal situation with a return to school tomorrow. Maliha.
Tina, Christmas break is officially over tomorrow, but kids will not be returning to the actual classroom. Due to the lockdown, virtual education is kicking in. One Mississauga mom